As students with autism spectrum disorders frequently have needs beyond academics, their educational plan is defined by an IEP. The IEP team is responsible for designing interventions, education, and instruction to meet the specific individual needs of each student. As the name implies, the educational program is a blueprint of what's going to happen in the upcoming year and should be tailored to the individual student. The key word is individual. A program that is appropriate for one child with autism may not be appropriate for another. With so many students receiving services within the autism eligibility category, legislation was developed to ensure that best practices were being implemented to meet the needs of students with an autism spectrum disorder. Take a look at these numbers, these frightening numbers. This graph shows the increase in number of children served in the state of Illinois since the year 1996-1997. In a past module, you learned that the current prevalence rate of an ASD was 1 in every 68 children. With this many children, it would be projected that over 38,000 students between 3 and 21 would be receiving services in the school system. However, we know this is just not the case. As you can see, in the 2011-2012 school year, almost 18,000 students received services and met the eligibility criteria for autism spectrum disorder. So where are the other students? Well, though some students may have a medical diagnosis of autism, they may not receive services underneath the eligibility criteria of autism. Also, as mentioned previously, some students may receive services within a different disability category, or there's not an adverse impact on the education, so they do not have an IEP. In the state of Illinois, Public Act 95-0257 was written into legislation and became effective January 1st, 2008. This law affects the development of IEPs for students with an autism spectrum disorder. This legislation requires that in the development of an IEP for a student who has a disability on the autism spectrum, the IEP team shall consider all of the following factors: the verbal and nonverbal communication needs of the student, the need to develop social interaction skills and proficiencies, the needs resulting from the child's unusual responses to sensory experiences, the needs resulting from resistance to environmental change or change in daily routine, the needs resulting from engagement in repetitive activities and stereotype movements, the need for any positive behavioral interventions, strategies, and supports to address any behavioral difficulties resulting from the autism spectrum disorder, and any other needs resulting from the child's disability that impact progress in the general education curriculum, including social and emotional development. Students with ASDs may have unique educational issues as a result of these 7 core areas that were outlined in the legislation. These factors require the team to comprehensively discuss students' needs that are consistent with best practices for addressing the needs of students who are diagnosed with having an autism spectrum disorder. Impairment in communication is one of the defining characteristics of autism. Therefore, communication skill development should be addressed as an essential piece of the student's IEP. Communication abilities of students with an ASD may range from individuals who are nonverbal to those who are highly verbal but have difficulty in the social aspects of language. When considering the verbal and nonverbal communication needs of a student with ASD, the team should review the student's current level of communication, the system of communication that's most effective for the student, the functions for which the student uses and understands language, the student's ability to use and understand nonverbal communication, including eye gaze, facial expressions and gestures, emerging communication skills that are reported by the family or any other team members, and any alternative augmentative communication assessments or systems and devices to enhance communication. The team must also include information about the student's current strengths within all areas of communication and skills that need further development and specific supports and interventions necessary to increase the student's ability to effectively communicate and understand others. Alternative augmentative communication, or AAC, is often effective for students with autism who are primarily nonverbal. AAC can be used alone or also in combination with verbal communication. There are many types of AAC, including low and high-tech devices. Assistive technology assessments are useful in determining whether a student would benefit from using an AAC system. Another core characteristic of autism is that of qualitative impairments in social interaction. In the most severe expression of qualitative impairments in this area, a student with autism may seem avoidant when it comes to social interactions, even with close family members. In less severe instances, the student may appear to frequently misunderstand the social situation and be unable to maintain a conversation on a subject other than his or her own special interest areas. A student with autism may have a lack of variation in spontaneous or social imitative play, or may have unusual play with toys, for instance, lining up cars end to end instead of rolling the car and making car noises. When planning for a student with autism's needs in the area of social skills development, the team should consider the child's ability to respond appropriately to the social approach of others, the types of social interactions the student is capable of initiating, the student's pragmatic skills, and any anecdotal information about the student's abilities within the small and large groups and in typical age level activities. For students with autism, social interaction skills are largely associated with the ability to communicate within a situation. Progress towards social skills development is a focus within the IEP of almost every student with an ASD. Social skills instruction should be at the student's skill level and appropriate for his or her age. Collecting and analyzing data on the student's social proficiencies will assist the team in development of the IEP. The IEP team should consider whether a student with ASD exhibits under or oversensitivity to particular stimuli. The following questions may be helpful in addressing this area. Think about tactile. Does a student demonstrate a lack of awareness to his or her body and space, and/or a need for a higher level of input in tactile experiences? For example, does he or she crash into the playground fence during a running game, or regularly bump into peers in line? Or does the student become loud and upset when presented with Play-Doh or a mixed texture food item? Or only wears tagless clothing? Visual. Is the student's eye gaze avoidant or fixated on particular sights? For example, is he or she drawn to certain objects, such as a shiny item of clothing, needing to stare at or touch it? Does he or she avoid looking at a particular sight, for instance, the flickering of a video screen? Or do certain visual stimuli excite him or her to increase their movement, like jump or run, or cause a fear response? Sound. How does the student with autism respond to auditory events? Does he or she have significant responses to sound, like volume, pitch, tone, or intensity that others may not hear? For example, the hum of fluorescent lighting. Does he or she appear deaf because of a lack of response to loud noises or the calling of his or her name? Do loud or quiet sounds, echoes, or a particular pitch enthrall or bother him or her? What about smell and taste? Does the student with autism respond in an atypical way to olfactory events or tastes? Does he or she have significant responses to environmental smells or tastes that interfere with appropriate activities and focus in on the educational environment? Does he or she smell or taste objects in the environment with unusual frequency or in unusual circumstances? Do certain smells or tastes upset the student with autism or appear to cause him or her to act in an unusual fashion? For instance, becoming loud or upset when a teacher wears a certain perfume. The team should consider all elements of the student's environment and know any specific environmental modifications or accommodations that are necessary for participation and effective progress in the Gen Ed curriculum. Family members are a valuable source of information on the student's responses to sensory experiences. Additionally, an FBA and sensory integration assessments can also lend useful information. Students with autism often have unusual or intense responses to change in their environment, such as moving the location of a piece of classroom furniture or a change in the daily routine, even when it's part of a familiar schedule. Planning and preparing for transitions with visual supports, timers, and verbal reminders often helps smooth the student's transition and promote success, flexibility, and independence. Visual supports are evidence-based strategies for supporting a student with autism. Providing a visual cue before initiating change in an environment or a schedule can support a student with autism to be able to adjust to the change. A visual schedule can teach the student to rely on written or a picture or object schedule information to manage moving between activities, and it also allows the student to anticipate change and rely less on a rigid memory of the order in which events are going to occur. Even in the most capable of students with autism would benefit from using a visual schedule to manage the activities of their day, to reduce anxiety, and also allow the student to better focus on the important activities within each day, rather than on their sequence. The team must consider how to introduce and teach an upcoming change or transition in the student's schedule. The team is encouraged to consider the use of a schedule and other visual supports to address the needs resulting from a student's resistance to environmental change or change in daily routines, as well as to consider other evidence-based methods for introducing new content to the student. Another defining characteristic of autism spectrum disorders are the existence of ritualistic behaviors, intense interests, and our repetitive phrases or behaviors. The team should consider identifying the function and the extent to which these behaviors interfere with the engagement in another, more appropriate activity, such as socialization or academic tasks. Direct observation or daily data collection should also be used. This information will assist the team in determining how and when to allow or modify the behavior within a student's day. As appropriate, teams should consider using positive behavior supports to encourage participation in learning and in other activities. Depending on the behavior, strategies for addressing engagement in repetitive activities and stereotype movements may include modifying and interfering behavior to be more socially acceptable, such as modifying a behavior of constantly shaking hands to occur only when introduced to a person. Teaching the student an appropriate replacement behavior that serves the same function and leads to more interest or on-task behavior. Teaching the student appropriate replacement behaviors that will enhance increased and appropriate participation in social activities with peers. Providing the student with frequent breaks in the form of sensory activities. Having frequent sensory breaks take place in the classroom. using special equipment to reduce frequency of movement, such as a cushion for the student to sit on during group reading time, developing curricular activities around the student's topic of interest, and slowly expanding the student's interest to involve other topics. It's also very important to identify reinforcers for the student. Data should always be collected and used to monitor the effectiveness of any intervention strategy. Because of the complex developmental, learning, and adaptive needs of students with autism, they often exhibit behaviors that are challenging in their intensity, frequency, or interference with the engagement in appropriate activities. The IEP team should consider and discuss the need for a functional behavior assessment of the student's behavior. For a behavior that has a relatively clear pattern, the FBA can be completed by obtaining some simple frequency data and antecedent, behavior, consequence information. Significant repetitive behaviors such as hand flapping or rocking or self-injurious behaviors may warrant a full functional behavior assessment to determine the reason for and function of the behavior and then possible alternatives to it. It is important to use the assessment data to determine why the behavior is occurring. Knowing the function that the behavior serves will then help the team determine whether positive behavior interventions, strategies, and supports are necessary, and which replacement behaviors are appropriate to teach. The team should select the least amount of intervention that is likely to be effective, efficient, and produce the minimum unwanted effects. Given the characteristics of social communication and behavior challenges that are exhibited by a student with autism, a well-written and appropriately implemented behavior intervention plan is an essential piece to many IEPs. A student with an autism spectrum disorder often exhibits deficits in executive functioning, or the ability to organize and the ability to generalize those learned skills into other environments or activities or functional routines. The student may have a tendency to perseverate or overfocus on unimportant features, which may distract him or her from the learning of the whole. The IEP team should consider whether there is a need to provide structure in the student's classroom environment and learning activities, including but not limited to intervention strategies for social skills development, such as self-advocacy and peer interaction skills, reviewing classroom and individual expectations, organizational supports, including visual organizers such as color-coded folders, and organized environments so that the environment has limited distractions, previewing information, direct instruction in order to learn new skills or to generalize learned skills, and repeated instruction and practice in multiple environments with a variety of materials and people in order to master a single skill. Quite often, a student with autism has a visual learning style that can be used to help accomplish new tasks and learn new skills. Schools can also use this strength to assist students with autism to move toward independent, individual success. ISB has also created a worksheet overviewing the 7 factors for school districts to utilize when developing IEPs for children with an autism spectrum disorder. This worksheet allows the team to identify students' needs and supports for the child. The Autism Consideration Worksheet is available in the resource section. As you work with students with autism, remember that the 7 factors for consideration were developed as a guidance and are not meant to be all-inclusive. Each child is an individual and is very different from another child with an autism spectrum disorder. When supporting a student with autism, each child will have different academic, communication, socialization, behavioral, and sensory needs that will all need to be considered. All students can learn.